Hey, I'm Dr. Gianforte from LifeWorks Integrative Health, and I've created this series to help people that are struggling with knee pain, people that are thinking about surgery, thinking about cortisone injections, people that are trying to avoid those and are just looking for other options. So what I want to do is I want to make sure that you clearly understand all of the anatomy of the lower leg, the knee, what happens when people start to get pain, so you can really make a good educated decision. So first, what we're going to go over today is the anatomy of the actual bones, so you understand how those bones should be working, how those joints should be moving, and then we're going to progress into the muscles. We're going to look at x-rays. We're going to look at how muscle dysfunction can cause rotation in these joints. We're going to show you how it breaks down in other videos, and we're going to also show you why the current model of taking care of our knees is not successful today and leads down a destructive path. And then we're going to show you a better way to begin to approach that is more proactive rather than reactive. So let's get into first looking at just the structure of the bones, and then we're going to start layering it on top. So this is obviously the lower body. We have the pelvis, we have the femur, the tibia, and the fibula, as well as your feet down here at the bottom. So when we start to think of knee pain and we start to look at the whole unit of movement with the lower leg, we have to look at this whole piece as a whole. And as you watch these videos, you're going to understand why all of it really ties together. So when it comes to joints, there's really three main joints that I'm going to discuss in the lower component of the body, the lower legs, okay? We've got the hips up here, we've got the knees, and then we have the ankles. Now, between these three joints, there's certain ranges of motion that each of these joints should be able to attain. The hip has 6 different ranges of motion that it needs to attain. It's a very mobile joint, okay? That joint has to provide a lot of range of motion, flexion, extension, adduction, abduction, as well as internal and external rotation of your lower leg, or of the entire leg. Now, your knee is actually a very, very stable joint. There's only really 2 main movements in the knee, and that's flexion and extension. So when you have a mobile joint, you have to have a stable joint right next to it, which is the knee. And then right below that, we have the ankles, and the ankles are actually another very mobile joint. They have 4 different ranges of motion. Now, if one joint becomes more immobile or becomes injured, the other one has to begin to take the stress of that movement. So let's say you sprain an ankle, you have an ankle injury, an inversion injury. The body will naturally try to stiffen that joint to try to protect it. So other joints are going to take the brunt of that being the knee. Say we have a low back injury, which is affecting the hips. This is going to cause stiffness through the hips, and this is very common among a lot of people, is stiffness through your hips. Well, this is going to increase mobility within the knee. And we don't want that increased mobility within the knee, because when that increased mobility is within the knee, it will start to wear down and break it down much, much faster. So in the next video, I'm going to zero in on the knee, and we're going to talk about the components that make up the knee and the cartilage and how that all comes together.